If you're a nurse, you know this feeling. You're on the front lines, you see the problems, the gaps in care every single day. Well, this explainer is for you. We're going to break down how you can take those incredible clinical insights you have and turn them into real, tangible solutions. Let's dive in. I mean, how many times a shift do you find yourself thinking, oh, there has to be a better way to do this? It could be anything: patient education, the discharge process, community health. Whatever it is, that feeling, that little itch that says we can do better, that's where every single great innovation starts. Now, I know that word entrepreneur. It can sound a little intimidating, right? But what if I told you that you've basically been training for this your entire career? Seriously, you don't need to learn a whole new playbook. You just need to apply the skills you've already mastered in a slightly new way.
Think about it. The nursing process is practically tattooed on our brains. Assess, diagnose, plan, implement, evaluate. Well, guess what? That is a direct one-to-one parallel with the innovation process. You already know how to spot a problem and create a plan of care. We're just going to relabel that plan of care as a business plan. It's the same logic.
Okay, so let's start where we always start: assessment. In our clinical world, you look at the chart, but you also go to the bedside and talk to the patient, right? Both are absolutely critical. And the exact same thing is true when you're trying to validate a new idea.
Just think of market research as your chart review. This is you looking at the big picture data, the hospital readmission rates, statistics from the Department of Health, things like that. This tells you if that problem you're seeing on your floor is actually a widespread issue.
But the chart never tells the whole story, does it? That's where market validation comes in. This is your bedside assessment. This is when you step away from the numbers and you go talk face to face with the people who are actually affected. This is where you hear their real stories in their own words. So here is the key takeaway, and this is so important. Market research tells you what is happening. For example, it might tell you that 40% of patients are missing their follow-up appointments. But market validation, that tells you why it's happening. Maybe it's because they can't get a ride. That why, that's where your real opportunity to innovate is hiding.
So once you understand the why, we have to dig even deeper. You know, in nursing, we don't just treat the symptoms, we find the underlying disease. And it's the exact same thing in business. We need a diagnostic tool to get to the real problem. And that tool is the 5 whys. It sounds almost too simple, but it is so powerful. You just state the problem you're seeing, and then you ask why, about 5 times. Each answer lets you drill down another layer until, bam, you hit the root cause, the thing you actually need to solve. Let's make this real. Here's a clinical example I'm sure we've all seen. The problem? Post-op patients are getting wound infections after they've been discharged home. It's a massive issue, leads to readmissions, bad outcomes. It's a mess. Okay, let's start. Why number 1? Why are they getting infections? Well, because they aren't cleaning the wound properly. Okay, makes sense. But why number 2? Why aren't they cleaning it properly? Because they are scared to even touch the surgical site. And we've all seen that fear, right? Let's keep digging. Why number 3? Why are they so afraid? Well, because they don't really remember the discharge instructions they got in a really busy, overwhelming ward. And why number 4? Why don't they remember? Because the instructions were just spoken to them. There were no pictures, no handouts, nothing to look at when they got home. And there we go. The 5th and final why gives us our root cause. It's not that the patients are being difficult or non-compliant. The real problem is that there is no accessible, step-by-step visual guide for them or their families to use at home. See? Now that is a problem we can actually solve. So you've found the root cause. Fantastic. Now, just like in a clinical setting, before you jump in with your brilliant intervention, you have to assess the whole environment. We need a way to see the full picture, strategically. And that tool is a SWOT analysis. It's just a simple 4-box grid. It helps you map out your internal strengths and weaknesses, the stuff you can control, and then it makes you look at the external opportunities and threats, the stuff in the world you can't control, but you definitely need to be aware of.
Now, let's focus on your strengths as a nurse for a second, because this is so important. Please don't underestimate these. Your clinical expertise, the fact that people in your community already trust you, your deep understanding of the local culture. These are massive advantages that most business people would kill for. All of those strengths together, they give you what's called an unfair advantage. It's what lets you create a unique value proposition, basically a super clear statement that explains why a family should choose your solution over anything else out there.
But to build that statement, we have to understand a really key difference. As nurses, we are trained to focus on the patient, the person getting the care. But in the world of business, you have to identify the customer. That's the person who actually makes the decision and pays for the service. A lot of times, that's a family caregiver or a relative living overseas. Your solution has to make sense to them. Your value proposition is built on what I like to call the nursing edge. You offer accessibility by bringing care right into the home. You provide education that empowers people to take care of themselves. You ensure safety through your professional monitoring. And maybe most importantly, you offer continuity, bridging that really scary gap between the hospital and home. And this all leads to a really powerful strategy. See, traditional healthcare often acts like a repair shop. It's reactive. It waits for people to get sick and then tries to fix them. But your unfair advantage allows you to be the maintenance guide. You can be proactive, focused on prevention and keeping people healthy and out of the hospital in the first place. This idea has a name. It's called a blue ocean strategy. The red ocean is where all the sharks are, all the hospitals and clinics competing and fighting over the same patients. You don't want to compete there. The goal is to use your unique nursing skills to create a whole new market space where there is no competition, a calm blue ocean. So your strategy becomes simple, but it is revolutionary. It's prevention over treatment. It's community-based care over institutional care. And it's empowerment over dependence. This is the unique value that truly only a nurse-led solution can bring to the table. So, I'm going to leave you with this question. Think about your last shift. Think about the frustrations, the workarounds, all those moments where you thought, this could be so much better. What problem on your ward is just sitting there, waiting for a nurse, waiting for you to solve it?